The biggest change is that the colon cancer screening rate age is being reduced from starting at 50 to now 45. And certainly, I think very few people will run in for a colonoscopy on their 45th birthday. But what I hope this will do is increase screening participation for those who are between 50 and 55, because we know specifically in that population that colon cancer is on the rise. Certainly, gastroenterologists and endoscopy suites around the country don't have the capacity right now to absorb those 20 to 22 million individuals into colonoscopy-based screening programs. What I hope we will learn in the next few years to decades is how can we best risk stratify individuals to determine, for instance, who between the ages of 45 and 50 should absolutely go for a colonoscopy versus those who may be able to start with a stool-based test and then move to colonoscopy if they have an abnormal result. So I think we have a tremendous opportunity here to learn a lot about personalized colon cancer screening. What the pandemic did was it dramatically decreased colon cancer screening. At the peak of the pandemic, colon cancer screening declined by 90%. We are slowly returning back to pre-pandemic colon cancer screening rates, but we're not quite there yet. But what the pandemic taught us at the peak of it was that we could safely deliver colon cancer screening testing at home for individuals who don't have symptoms and don't have a family history, that this was an opportunity to use those tests on a more frequent basis. So again, as I mentioned, because these 20 to 22 new million people who will require colon cancer screening cannot all be absorbed by colonoscopy-based screening, I am looking forward to us studying how we can better and more increasingly use stool-based tests in those populations. One of the major gastroenterology societies for many years has recommended that Black people begin colon cancer screening at 45 because Black people are at highest risk of getting colon cancer and are more likely to die from colon cancer than any other racial group in the United States. Currently, many patients face challenges in getting that test covered because insurers use the USPSTF to decide what tests they will or will not cover. The Affordable Care Act states that anything that is graded A or B by the USPSTF must be covered by insurers in the country. So with 45 becoming a grade B recommendation of when to begin screening, I'm excited for Black people and other high-risk populations who needed earlier screening to have this important test covered.